Good job taking out those bad guys. Don't be anxious about it. Don't leave me. You did a great job. Oh, you're right. Somebody here. Just a second. There we go. You wanted to chat about your hypertension, didn't you? Absolutely. So what we'll do is we'll do a cardiovascular medical exam. And then we're going to talk about some things that we can do, given your family history that you mentioned to me, to decrease your risk factors. Absolutely. So as you know, I'm Jen. I am an actual physician. However, everything that we do in this kind of secret place where we are is going to be for your education and self-care only. I can't give you official medical or advice for diagnosis or treatment of any illness in like meat space, because you and I haven't had an official consultation and so forth. But of course, here in this imaginary internet place, you and I can do whatever we want. Okay, so let's talk about your hypertension. So, you did tell me a little bit. You did tell me a little bit. Let me just get my stuff here so that I can. Right. What were your biggest concerns? How many family members with hypertension? And how many deaths in your family due to a stroke or a heart attack? I see. And any first-degree relatives that currently are diagnosed with hypertension and it's uncontrolled? Do you know what medications your family members are on? Good to know. How about you? Who told you you had high blood pressure? So high blood pressure is technically defined as a systolic blood pressure over 140 and a diastolic over 90, unless you have diabetes, in which case the number is 135 over 80. To get the diagnosis of hypertension, you have to have a number above that twice at 2 different doctor's visits. Now, because a lot of people have white coat hypertension, they get stressed out when they see this. For good reason. This carries a lot of germs. I don't wear this in my meat space interactions. This would just help you feel a little bit more, with me. Yeah, so some people get white coat hypertension, and because of that, really the best way, and the way I always diagnose hypertension, is I have people go home with a blood pressure monitor, and for 5 days they take their blood pressure in the morning, afternoon, and night. Not right after a meal, because if you take it right after a meal, it's lower because your parasympathetic nervous system sends all your blood to your digestive system to help you digest. So not right after a meal, but morning, noon, and night. And for 5 days. And then we look and we see how many of those. And if, the average, more than half of those is going to be above those numbers, 140 over 90, then we're concerned. Really, the guideline, if you're interested in looking into this, that really regulates hypertension is the JNC8 guideline. It was a big consortium, a bunch of different experts who came together to review all of the available studies and literature. Exactly. So that's what we mean by hypertension. So have you been diagnosed with hypertension before? I see. Okay. That is a very good question. So, predominantly, we like to start with, oh, somebody would like to come in. Would you like to come in? You can come in. Come on. Come on. Somebody really wanted to come in. Somebody is getting grumpy because it's getting dark out and it's scaring her a little bit. Would you like to sit on my shoulder? Are you complaining? Are you complaining? Here, sit on my knee. Let's close the door. Let's close the door so that our people can have a good hypertension visit. Oh, honey bun. Are you scared because it's getting dark? Yeah, are you telling me about it? Can you say hi to them? This is pistachio. And of course, this is cinnamon over here. I don't know if you can see him. Over there. Sitting there. Can people see? I don't know if people can see him. I have not seen a study about animals reducing blood pressure, but it wouldn't surprise me. It would not surprise me. So you were asking about blood pressure medications. Yeah. Well, so if somebody meets those criteria is when I would start them on a medication. However, I would always give them the option first to trial for about a month and a half, 2 months, an intensive exercise and diet regimen. Because you can actually decrease your blood pressure significantly with those things. Yeah, and then of course, once I diagnose someone with high blood pressure, we also get, an A1C and other numbers, so that we can check and make sure there's not something else like diabetes or something else like that. Yeah, exactly. Well, let me just enter in some of this information into the computer here. And we'll just pull up. Are you eating my pen? A little bird is eating my pen. So let me just open this here. Just real quick. So what I want to do is while we're working together, I just kind of want to make sure that I have everything kind of both in digits and on the computer, and check your current records. So that we can see, since you're not exactly 100% sure about your diagnosis. It's hard to type with only one hand, honey. She's gonna go ahead and eat this little check. She keeps us accountable. Oh shoot, why did it do that? Why did it do this? So I'm just kind of looking through your old records here from your PCM. Of course, you should always consult your PCM, so they're the one who kind of know you. Yeah, exactly. And you can just kind of sit back and relax, and I will answer all your questions. You don't have to worry. Let me just make sure I look through this handout for you first. Look at your, not handout, but look through your stuff. Okay. That's pretty good. Alright, so let's go ahead and do a physical exam. Have you had any headache? Let me just take this over here behind you. Let's just wash our hands real quick. Let's just get some good hand sanitizer on our hands. Excellent. Okay. Alright, sweetie, are you gonna help me? Are you gonna help me? Alright, so the most important thing with cardiovascular is obviously heart, lungs, distal pulses, and then checking, for JVD, and listening to your carotid, and then a quick look into your eyes as well. So that's kind of what we'll keep it to today. Do you have any chest pain regularly? Okay. I don't know why I have this in my ear. Any chest pain? Okay. Excellent. Okay. And then let me just switch over to the bell here. That's the other side of the stethoscope, and listen to your neck right here. And then the other side over here. Okay, very, very good. Alright, and then same thing with the bell. I want to listen to your aorta and your stomach, your abdominal aorta. Okay. And then we have you lean back a little bit. Check for JVD, okay? I'm just gonna have you lean back so that I can then look over here on this side. Perfect. And then we're just going to feel your pulse right here. Excellent. And then over here. Good. And then I'm just feeling both pulses in your radial arteries here in your wrist. And then can you take your shoes off? I just want to feel your dorsalis pedis pulse down here. Okay, that's perfect. You can't be loud. You have to be quiet. I'm gonna have to find and edit out your loud noise. Shh. Do you need to leave? Do you need to leave? You sound like a little guy who needs to leave. I'll let you out if you want to get out. Oh, are you stressed? Hold on, he's stressed. We gotta take a break and let him out. He's unhappy about something. I don't want him to be unhappy. Give me just a second. Boom. And I transported them back to their own dimension. Yes, it's an unusual doctor's office we have here. So, we were talking about your hypertension. We went ahead, we listened to your heart. What I'm looking for there is I'm trying to hear and see if you have any murmurs, irregularities, arrhythmias, things like that. And then listening to your aorta is important because your aorta, in people with severe hypertension or a genetic predisposition, they can have an aneurysm. That's where part of the wall of the aorta, because of the blood pressure, starts to tear away from the other part of the wall. And that part can fill with blood and blood and blood and blood. So this is the whole aorta, and you have the wall here. It starts to do like this, and if it tears open, there's so much pressure in here, you can die within 4 minutes. That would be called an aortic dissection. Aortic aneurysm is just that, and you can hear it. You'll hear like a bruit or something that sounds weird. It won't sound like a very consistent beat. It'll be like brrr, instead of what it's supposed to sound like right there in that area. And you listen for similar things in the carotids. When you're checking the pulse, you're checking to make sure that both sides are equal bilaterally. Because if there's a heart deformation or something else like that, they won't be. And of course, checking your dorsalis pedis pulse. If you have very bad peripheral vascular disease because of smoking, diabetes, anything else like that, it'll decrease the vascularity down there, and you might have really low pulse. So kind of checking your whole health. So that's why I check all those things. So here's the thing. Oh, you have something. Is it okay if I touch your face over here? Just a little bit over here. Something on your face over here. Perfect. Okay. I think from your adventures, you had a little bit of alien blood on you. So here's the thing. Oh, all good with your... Okay. So here's the thing, hypertension-wise. Serious time. The reason hypertension is bad is because, it can worsen things like aortic aneurysms. It can worsen things like brain aneurysms that some people have genetically by birth. They might have little brain malformations that can do the same thing, like the wall tears, and then you can have a stroke. In Spanish we call it, derrama, like a derrama. Es un infarto que derrama el sangre. So there's two kinds of strokes, right? There's a stroke where there's like an obstruction, and so blood doesn't get to an area. That's like somebody who has atrial fibrillation, and they're putting tiny little clots up into their brain that can clot and block a piece of blood, a piece of vessel, right? And then that piece of vessel doesn't get any oxygen, and so it dies, that part of the brain. And that's one kind of cerebral infarct or stroke. Another kind of stroke is where there's so much blood pressure that something tears and you have blood spilling into the brain, like a bleed, basically, kind of stroke. And the tough thing with managing strokes, it's a big emergency situation because a lot of the medications that we use to treat one kind of stroke could cause the other kind. You have to be very careful. So, we'll do things like blood thinners and other kind of things. Aspirin, that's easy, but there's some more dangerous stuff that we might use. So that's the danger of high blood pressure, is that you can have a stroke and then lose brain function, not be able to talk, not be able to do the things you like to do. And then the other thing, of course, is you can have a heart attack. And that's because it's different than a heart attack because of hyperlipidemia or high cholesterol. It's a kind of heart attack where the blood pressure is so much right? That the heart is having trouble, keeping up with it and keeping up with the oxygen demands. And you can start to get a lot of chest pain. And you can get chest pain even if you just have really bad hypertension and not a heart attack. And, the heart can't keep up with that demand, and so the pieces that are a little bit more clogged, that are a little less oxygenated, will start to die because it isn't able to give blood to itself because it's pumping so crazy. That's kind of a simple way to think about it with hypertension. Obviously, hypertensive myocardial infarction, it's gonna, in most people, it's not one thing or the other. Most people who have hypertension also have some kind of plaque or something like that, and so you have that intense blood pressure pushing against a plaque. It can break it free, it can become a clot, it can clog up a piece of your heart. That's kind of more what happens, is that it's multiple things all together. So when we're looking, like somebody does puts a catheter in through your femoral artery and goes all the way up there with a little camera to look, and then to get, open up blood vessels. That's what they do. It's like PCI. When somebody's having a bad heart attack, we can save their life that way. Cardiologists do that. I've never even seen one done, because I'm not a cardiologist. So that kind of thing, that special technique, focuses on removing the plaque, right? But it's really important, and a lot of times right after a heart attack, we'll put somebody on something called a beta blocker to slow down their heart rate and change their contractility so the heart isn't fighting so hard. And that actually, beta blockers were one way to deal with high blood pressure. In that kind of situation, that kind of like post-myocardial infarction situation. However, most people are not going to use a beta blocker for their hypertension. Most people, if you're just starting out with your new diagnosis of hypertension, we'll start out with something called hydrochlorothiazide, which is a diuretic. Makes people pee a lot. The JNC8 did find that a lot of black people were at a disadvantage because genetically, some of the blood pressure medications we like to start people on, especially ACE inhibitors, they're more likely to cause angioedema or bad allergic reactions, cough, other kinds of things like that, in people of African descent. So for our patients of African descent, we prefer to start you on a calcium channel blocker. Calcium channel blockers are phenomenal. They have a lot less side effects, and I actually like to think about starting everybody on them. Because they do have less side effects. You're less likely to get those other, situations, angioedema being like where you get swelling all over your body and you can get it bad enough that you can't breathe sometimes. It can be a bad situation. And ACE inhibitors are very good, and they're part of the first-line medication, but just not first line for our black patients. So, if you were my patient exclusively and we weren't corresponding with your PCM, I would think about putting you on a calcium channel blocker. Hydrochlorothiazide is another really good first-line medication, like I mentioned. It helps you pee off extra fluid so that you have less, and it does that by changing sodium balance in your kidneys, so that you have less fluid and you aren't so... less fluid means less pressure, right? The problem with hydrochlorothiazide in my population, I usually work with a military population, is you can't be out in the field and needing to pee all the time, because that's the more times you need to pee, the more times you're vulnerable to getting, killed, right? It's just not a good deal to need to pee all the time. So I really like calcium channel blockers for that reason. Like I said, beta blockers are used for particular situations. Maybe they're not first line at all. Before you use a calcium channel a beta blocker. And the difference between a calcium channel blocker and a beta blocker: calcium channel blocker specifically works on the calcium channels in the muscles of the heart, right? That are helping it to contract. A beta blocker works further up the chain, and actually works based on it blocks the work of your sympathetic nervous system. So your sympathetic nervous system tells your heart to beat more, and your parasympathetic nervous system tells your heart to calm down. Exactly. Should I be doing trigger at the same time? I probably should. We're just talking here. So yeah, does that make sense? Yeah, so what a beta blocker does is kind of stops the sympathetic nervous system from telling your heart to beat more and faster. It kind of gives your heart a break. that's not a really good thing, again, for people like soldiers who need to have their sympathetic nervous system ready to go if they need to be up and at 'em and fight and stuff like that. They need to not have like that fatigue and kind of slow down that you can have. But people who have like stage fright and not very bad hypertension, that's a case in which you might start someone on a beta blocker. But that'd be very unlikely because beta blockers help with stage fright. Isn't that weird? But that would not be a very typical use. That would, that's not really in accordance with the JNCA guidelines. That would be like an exception that I can maybe think of. Otherwise, really, you start with an ACE inhibitor, a calcium channel blocker, or a thiazide. The issue, like I said, I wouldn't usually start a lot of people on ACE inhibitors because they're just not as good for my Black patients. Another second line is what's called an ARB, an ARB, like losartan and those kind of things are good options as well. They work similar to the way ACE inhibitors work, but a little bit higher up the chain. ACE inhibitors basically stop like lisinopril and other things like that. They basically stop what's technically part of your immune system pathway that affects how it's technically part of your immune system. It's also part of your obviously your blood pressure regulation through your kidneys. It works through a mechanism in your kidneys basically, so it's kind of different than the ones that are working like directly on your heart or the ones that are working see, another thing about calcium channel blockers is they block smooth muscle, so your smooth muscle isn't contracting. Your blood vessels are made of smooth muscle, so they'll contract like that, and calcium channel blockers will let them chill. And the calcium channel blockers that we really use for hypertension are not so much the ones that target the heart, but the ones that target the blood vessels. So, but they all have overlapping work. But anyway, so like different blood pressure medications work in different part of the body. ACE inhibitors specifically target some things in the kidney that affect, your salt regulation, other things like that, but also affect different things in your immune system. And that's why sometimes they can have, because they work also upstream from your prostaglandins and bradykinin, which affect the permeability of your vascular system. Am I going a little bit too? So anyway, there's a lot of great blood pressure medications, but like I said, I like to give people about a month and a half to do something else first, and a lot of times you can see a lot of change with that. So I actually have my exercise prescription right here for you. It's my little exercise recipe. Here's the thing with weight reduction: if you can get your BMI under 24.9, right, that's your body mass index, you drop between 5 to 20 millimeters of mercury with every 10 kilograms of weight loss. That's really good. That's really good. 10 kilograms is not a lot. That's not a lot of weight to lose. And each of that drops your blood pressure. So if you just have like a slight blood pressure, say you always run in the like 150s over 95s, really, that's where I would focus my attention first. Would you like me to measure your BMI? Yeah, let me get my little measuring tape here. And what we'll do is I'm just going to check your height. Just check your height here, all the way down here. Check your height. And then we'll turn on the scale that you're sitting on. Good. Let me have you stand. Well, you are technically. Yeah, let me have you kind of stand up a little bit. Perfect. And that's good. And then we'll check your weight here. Okay. And then another thing that we can check is we can check for your risk of like sleep apnea related to your weight and stuff. We can check your neck circumference. Actually, right here. Check around, just all the way around your neck here. Okay. And then sometimes it can help to know waist circumference, because that's another factor that your decreased waist circumference by itself, independent from BMI, is also correlated with improved blood pressure. So, here we go. So, alright, perfect. And let me just notate down those points. So here's the deal. When we talk about weight loss, the goal is not to make you feel like ugly or unattractive. I am very attractive, and I have a BMI that's over the healthy limit. I'm at, I've often been at 26 most of my life, and I'm pretty sure that I'm above 30 again now, which is unfortunate because I had lost like 5% of my body mass when I was deployed to Korea. You can be gorgeous and overweight. The reason for losing weight isn't to be beautiful, because you're already beautiful, regardless of what Western standards say. There are a lot of countries where they try to make their women fat, especially because the more fat is the more beauty, right? And even in like other languages than English, like in Spanish, gordita is not an insult. You call people, you say, oh, she's a little fatty. It's not an insult, actually. It's like, yeah, she's just, hey, un poco gorda. It's like you're a lot more blunt, because things are not like so, it's not like a sign of bad character. Like it's kind of been done because of a lot of like Victorian, Western European, English speaking norms. Okay, you're gorgeous. The issue is that you want to be gorgeous and feel good, so you want to be at a weight that works for you, and that's going to be slightly different for everybody, because technically BMI was created as a measure of population, not supposed to be as an individual measure of health as we kind of use it. BMI does correlate with certain health things. Like I said, decreasing your BMI tends to decrease your blood pressure. But as it was initially intended, body mass index was supposed to be a measure of population weight and not used as an individually prescriptive technique. Okay? It's possible for you to be a little over or a little under, and for it to be normal for your body. People are a population bell curve, and out here at the edges of the bell curve, some of us are a little different. However, in general, losing weight is going to be better for you. That's kind of what the studies show. And it's better to make you feel more energy and make you feel, strong and healthy. Not because you're not beautiful, okay? You are, it's inappropriate for me to say this, but you are super sexy, okay? So, that's one way that you can help to prevent your risk, right? Is by lowering your body mass index to under 24.9. If you want to lose weight, you want to be doing more than 150 minutes of moderate intensity cardiovascular exercise a week. The American Heart Association for your heart wants you to do 150 minutes a week. And that does help with lowering your blood pressure. But if you want to lose weight, you want to be using kind of the more Mayo Clinic guidelines. So you're going to be doing a little more than that. So those 150 minutes can be broken up however you like. You can do 5 times a week, exercising 30 minutes. And I know it's a lot. So start small. Because intensity, if you do like high intensity exercise, it's only 70 minutes a week, right? Moderate intensity exercise is like you're running and you can breathe, but you can't really talk. It's hard to talk. High intensity exercise, there's no way you're talking. You're 100% focused on that, because you're like, and your heart is like 1,000,000 miles a second. That's high intensity. So modulate the intensity, right? And get yourself like what is best for you. And start small, okay? Like make a plan. Like maybe you can't make a plan that, okay, I'm going to do 150 minutes this week. Start small. Be like, okay, after lunch, I'm going to walk for 10 minutes. And then build it up as you do each week. You add a new thing. You add 20 minutes, right? Start small. That will help prevent that will help protect you. Another thing you can do is using the DASH diet. Have you heard of the DASH diet? So a lot of people complain about the DASH diet because there's not a lot of salt in it. It stands for Dietary Approaches to Stop Hypertension. It's a diet rich in fruits, vegetables, low-fat dairy, and that particular diet also has decreased fat in it. Now, there is a lot of evidence now that fat is not the thing that causes you to store fat. You use fat, and there's a lot of things in fat that are good for your brain, like omega-3 fatty acids and things like that. Trans fat's not so good because they tend to clog up your arteries, but in general, fat is not the bad guy. Sugar and carbs are the bad guy. And by carbs, I mean like simple carbohydrates like pasta, white bread, things like that, okay? It's best if you can kind of move more towards vegetables and meats and healthy fats. And that's when we get into talking about the Mediterranean diet. Mediterranean diet is a little bit more fun than the DASH diet, and it's something you can certainly look into. I can actually give you a printout. Perhaps I might not be able to give you a printout, but if I am able to give you a printout, it's down in the description. You know how I do. You know how we do up in here. Yeah. So the blah 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 blah. We were saying things. I'm trying to kind of just be me a little bit more in some of these things, because I appreciate you and I respect you and I want this to be real. I think that's what I have to offer that other people don't have to offer, is like, I am the real me, almost 24/7, no matter what I'm pretending to be. So we're gonna leave it in. We're gonna leave in the sillinesses, right? Because you are special and I like hanging out with you here, you know, like, we're legit. So diet recommendations. So what I usually tell people is half of every plate should be fruits and vegetables. And I have my like diet handout here that you can probably have. You're gonna eat a variety of vegetables from all groups. Okay, so you want dark green, red and orange, beans and peas and others. Okay, you want to eat the rainbow is how I tell it to kids. Or another way I tell it to kids is you want to eat the superpowers. You want to get every vitamin you can in different that exist in different fruits and vegetables. There's an old Chinese proverb, let your food be your medicine. Okay, if you start, instead of thinking it as like, oh, I'm on a diet to lose weight and I'm limiting stuff, think about it as, this is my lifestyle and I am always on the hunt for foods that can strengthen me and give me power. For example, vitamin A in carrots, good for your eyes, right? Antioxidants in blueberries, good for your longevity, and for your mood. You look at vitamin K in spinach, good for, keeping your blood thin and regulated and like what it's supposed to be, right? The things that you're supposed to eat, right? The things you're supposed to eat are the things that give you power. So you go around looking for that, right? You go around looking for the things that give you power. Think about it that way instead of like a punitive thing. And then even if you do the DASH diet, so here's the difference between the DASH diet and the Mediterranean diet. So the Mediterranean diet, you have to have olive oil, about 4 tablespoons per day. You have to have tree nuts and peanuts, at least 3 servings a week. Fresh fruit, 3 servings per day. Vegetables, 2 servings per week. Fruits, more than 2 servings per week. Try to do white meat in place of red meat. Wine with meals, about 7 glasses a week if you drink. No soda, commercial baked goods, sweet pastries, spread fats, red or processed meats. The DASH diet is saturated fat is 6% of your total calories. Total fat is 27% of your total calories. Carbs are 55% of your total calories. You get 30 grams per day of fiber. Cholesterol is 150 milligrams per day. What does all of that mean? And the kind of carbs they're talking about are not simple carbs like your breads and things like that, although the DASH diet is more lenient with that. So at the DASH diet, you eat a little more carbs because you're worried about salt. You're worried about the way salt interacts with your kidneys and causes your blood pressure to go up. Because the more salt you have in your blood, the more water sucks out of your cells in third place to get into your blood to balance that out, and then the more pressure you have, right? And that puts a lot of strain on your kidneys. Your kidneys have trouble regulating. Your kidneys need salt and use salt to regulate how they filter out waste. They can't do it very well if they have too much salt. So your kidneys are a big deal in regulating your blood pressure, and that's why, pretty much cut out all salt is the idea. Some people will use a potassium iodide salt instead of sodium. Potassium is also used by your kidneys, but in a different way and doesn't draw in water exactly the same way. So really the DASH diet focuses on getting rid of salt and not so much on carbs and stuff, and then lower fat so you don't build up as many plaques. The Mediterranean diet focuses on getting you a lot of good fats, a lot of good tasting stuff, but really, really cut down on the carbs in comparison to everything else. And really focus on adding things like olive oil, red wine, and things like that. So you can pick one and see what works for you. The DASH diet, in some ways, you'll be able to find more recipes for it. I think the Mediterranean diet is a little easier to cheat on. The DASH diet is the one that has the best evidence for hypertension. So that's what I recommend people with high blood pressure, is cut out the salt, replace it with herbs and other things like that, and you'd be surprised how much salt there is in your canned foods and stuff like that. It's crazy. So cook fresh and eat stuff that's like fresh and really savor the taste of the food itself. Like get into that, like get mindful of that, like chew your food and like connect with the earth through this food, right? And that can also like really experience the taste and don't like cover it up with a bunch of salt. Like make this into a good thing, a special journey into the bounty of the earth, instead of like, oh, I can't have salt anymore, like really depressing, like I'm bad and fat and I have high blood pressure and that's why I can't have salt. Like, you know, a punitive thing. Don't make it a punitive thing. Make it like a celebration, like I'm exploring what I have in a new way, and I'm gonna find the flavors of food as they really are. And I'm going to learn different herbs, and I'm going to learn different like plants that I can eat that'll give me power. And I'm on a journey, right? Because I matter. I'm here on this planet to do something important that only I can do. So I'm optimizing my body as a tool so that I can do it. Right? See how different perspective that is? And that perspective works a lot better. It's called motivational interviewing. The I hate myself perspective does not work for weight loss. In fact, it increases your cortisol, which helps you store more fat. So it's a waste of time to hate yourself. It doesn't work. It doesn't work. So anyway, using the DASH diet can decrease your blood pressure by 8 to 14 millimeters of mercury. That's pretty good. And of course, sodium reduction by itself can decrease you another 2 to 8 millimeters of mercury. You know, and if you can do 30 minutes a day, every day of physical activity, and it doesn't have to be a chore. It doesn't have to be like, oh, I'm good. Now I have to go running. Do aerobic activity you like. Ride your bike while you watch a show. Go try a new activity, like, you know, something like jiu-jitsu, or which I think is awesome. You know, live an active lifestyle the way you would have as a hunter-gatherer, not because you have to in order to burn off your Western lifestyle. Like, live an active lifestyle because you're exploring new things. Try a new thing every other day. So yeah, sometimes go for a run, but mix it up. Go swimming one day, or if you don't have a pool or anything like that, or you don't have access to a lot of new things, look up new skills online and try those for a little bit. Do a little bit of kickboxing for half an hour. You know, do fun things. Be creative. Flex your brain. Make it into superhero training, okay? Don't make it lame. Don't be lame. So for alcohol consumption, you can also decrease your blood pressure another 2 to 4 millimeters of mercury by keeping your alcohol down to 2 drinks a day if you're a male, or 1 drink a day if you're a woman. Why is it sexist? Well, because the way that the male and female bodies work, just the biological reality of it is, in general, most females do store more fat because that helps for the reproductive system. You need more fat so that you can, you know, feed babies and things like that. And you also tend to be smaller as a woman. And that's really because of breeding. That's not necessarily the case, and it's different in different societies. Women aren't necessarily weaker or smaller just by being women. It's because throughout a lot of societies, especially Western societies, you'll see it's different in a lot of African societies. You have like really strong, larger women. In a lot of Western societies, women who were larger or more assertive didn't get to pass on their gene pool. They didn't get to pass on their DNA because they weren't selected for reproduction. The culture of selecting small, tiny women for reproduction creates more small, tiny women, right? So it's not that like women are less or weaker or anything like that. In fact, the Olympic times for women, for biological women, are almost approaching the same Olympic times as for biological men, which is pretty, for running, which is pretty, you know, awesome. So, you know, your body can be and do all kinds of things regardless of your gender. But it is true that you were given this sex, you know, that is meant evolutionarily to reproduce a certain way. And because of that, there are some just biological realities, like your risk of penile cancer versus your risk of cervical cancer, your risk of your different hypertension risk, you know, the kind of heart attack that you have as a man versus a woman. All those kind of biological things do make a difference. And so you need to love your biology and not deny it or hate it. You need to understand, like, oh, this is my body. I can still do the things that other people do. I just have to learn how to do it within my biology and learn how my biology adapts, right? How I do it. I love that scene in Mulan where everyone is trying to like strong arm their way up this pole, and she does it her own way using the strap thing that she uses to climb up. You can achieve results. You gotta just respect your biology and do it within your biology. You can achieve results by doing things your own way. You know, you don't have to become a man, basically, to do the things that a man does, basically. I don't know if that makes sense. So all that to say, like, the reason the differences in alcohol consumption for women and men is because there is a biological difference, usually in size and in fat. Alcohol is metabolized a lot faster in people who have more fat. Yeah, so, or not, it's not metabolized faster, it hangs around longer. It doesn't, it impacts you more. Yeah, exactly. So, you can decrease your blood pressure 2 to 4 millimeters of mercury by kind of sticking to that rule. 1 drink per day for women, 2 drinks per day for men. Now, of course, you gotta be smart about this. If you are a tiny-ass man, you should probably have 1 drink a day. If you are a super big, large woman like myself, and it's not just because of fat like myself, it's because you're a muscular, giant hottie, you can probably drink a little more, but, keep it to 1 to 2 a day, basically, is the rule. Generally a little less if you're a woman. Like that, limiting it that way can also protect your blood pressure. So let's add these things up, right? We have the decreased alcohol consumption, at least 2 points of blood pressure, at least 5 from physical activity, so that's like 6. At least another 2 to 8 for a dietary sodium reduction. We've been picking the low end of the other 2, so let's make that 10. So that's 16 points. Doing the DASH diet, average of 10, so that's another 26 points. And then just losing weight, I mean, you can drop your blood pressure like 30 points, maybe on average, putting all these things together. So it's you don't necessarily have to be medicated, is what I'm saying. Like, you have some power of your own, which is good because these things are cheaper than medications. Right? Things get expensive. So let's see what else I have for you. I think that's going to be most of what I have for you. Oh, what's a drink of alcohol? So a 12-ounce beer, a 5-ounce wine, and like a shot. Yeah. So like this, and then this. That's a drink. And we say ounces because you can't be like a glass of wine and then you get like a giant ass, you know what I mean. Yeah, so that's those things. I think if you do those things, they will help you with your blood pressure significantly. Yeah, and of course you always go to your doctor because there's always some people have other reasons for their high blood pressure. Hyperaldosteronism, which is a problem metabolizing your potassium appropriately. Like, if your blood pressure doesn't respond to these measures, and then your blood pressure also doesn't respond to standard medications, ask your doctor to look into something for you. Ask your doctor to look and see if your kidneys are working right. Ask your doctor to look and see, if you have, because kidney disease, a sign of kidney disease, and some people just get inflammatory kidney diseases for no reason. Big sign of that can be that your blood pressure goes up for no reason, and a lot of people will keep trying to medicate to get your kidneys to shut up. But that's actually not the problem. The problem, you need to do something else because the kidney itself is sick. It's not that you have high blood pressure and we're just trying to drive down the high blood pressure. Your kidneys are actually sick. Oh, what causes high blood pressure? So it depends on the person, right? And somebody like that, who has like a biological issue with their kidneys, the kidney regulation, backup, and other kinds of things like that cause it. But a lot of times what causes high blood pressure is, in addition to electrolyte imbalance, it's hardening and stiffening of the blood vessel walls, and as they stiffen more, and this is why it goes hand in hand with high cholesterol, right? As they stiffen more, the intima, which is the inner layer, and then you have the media, which is the other layer, those things harden, and then they start to take damage, and as they take damage, because of a lot of the blood shooting through there, it's like hurting, it's like this shear force against this blood vessel wall, they start to release more inflammatory cytokines and other things like that because they're being damaged, and then as those things are released, more inflammation comes to those areas, and it actually gets worse instead of better because that blood pressure is so high. Because usually what you would do to fight off, like if you had an infection or something like that, you would want blood to come to the area, clean the area, bring white blood cells to the area, kill the bad guys and move on. But in this case, the bad guy is your own high blood pressure. Stress can increase your blood pressure because your heart is pumping faster and more. And basically the hardening of your blood vessels can be because of like, you know, a calcium channel problem, which is why calcium channel blocker is good. Or, you know, because of the way your lifestyle creates inflammation, creates tension in those, you know, blood vessel lines. And a lot of times it is genetic. A lot of times some of us over time just have harder blood vessel walls, and the way we can protect that is, you know, like exercise helps to release antioxidants and other kinds of things like that like calm down your blood vessel walls and things like that. Like some of us were genetically meant to be much more active than we are in Western society. Although of course in you know, majority world nations or lower income nations, it's also possible to get high blood pressure, and that can be because of stress, because of access only to salty carbohydrate food. It's basically like if your body isn't getting the food that it needs to heal, it becomes stressed. Kind of like a fish in the wrong water. You put a fish in the wrong water, it becomes stressed and it dies. And it's really the same thing, like your environment and your body are not lined up appropriately. You're not getting the things you need so that you have enough, you know, vitamins, you have enough antioxidants, you have enough things to keep your blood vessel walls nice and squishy. You know, you don't want those bad boys hardening up. I hope that kind of made sense. I tried to put it in simple terms. Yeah, and a lot of times we get dealt certain genetic hands, but that doesn't mean you can't do anything about it. I hope this was helpful. Thank you for spending the time with me. Do you have any other questions? Okay. I hope this was also ASMR-y. I only did a little bit of, I did what I would do in a real doctor visit, right? Sorry to ruin the immersion for you there, but like, I kind of want to make this one a little bit more like, you know, you and me are talking, since you did ask me the question about hypertension. So we've got the whispering, but maybe, you know, let me know in the comments if there's certain triggers you'd rather have incorporated. I feel like that does make it less doctory, which is why like the fantasy ones are better for incorporating weird stuff like that. But anyway, I think this will be helpful for you, hopefully answer some questions. You can ask me more questions about hypertension down in the comments. Yeah, exactly. You might be asleep by now. I hope you sleep well. Hope you sleep well. Different triggers and things like that we can also do during talks other times. Maybe I should have tapped on something or crinkled more paper. Let me know what you think I should have done. I appreciate you.